Because honestly, the bottom line is, let's face it, insurance companies are out to make money. Um,
Yes.
and the unfortunate side is that those of us that pay for these insurance plans are looked at pretty much as just a dollar sign for them.
Pretty much.
Let's have a conversation about cognitive decline. Let's have a conversation about physical decline. We're educating masses about the brain and the spine. We're educating people about balance, gait, and decline. Let's have a neuro wellness conversation. Let's have a neuro wellness conversation. Let's have a neuro wellness conversation.
Welcome to Neuro Wellness Conversations, where clinical insight meets lived experience. We're two physical therapists having real conversations about neurologic wellness, nervous system health, and what it takes to support both in everyday life.
And tonight's conversation is an important one because many people across the country are starting to feel the effects of healthcare changes, staffing shortages, funding pressures, and reduced accessibility to care. Research is now projecting that millions of Americans eventually lose healthcare coverage over the next several years due to Medicaid policy changes, which is crazy,
Yep.
administrative barriers, and work requirement expansions.
Yes.
And what's important to understand is that many researchers are saying the issue may not even be about whether people qualify for care, but whether they can successfully navigate increasingly complicated systems and paperwork requirements.
Right.
So tonight's talk, we want to talk honestly about what this actually looks like in real life for patients, families, caregivers, healthcare providers, and the underserved communities.
Yes. So important because,
Absolutely.
with the difficulty in the accessibility of getting healthcare, it's not even so much just about the insurance, it's about whether the services are actually existing in their neighborhoods or in their
Mhm.
communities. Whether people can access physicians or medical care because of appointments, whether doctors are available, whether people can receive care before reaching, crisis mode. This
Mhm.
is such a timely topic and discussion for us to have today. And I'm excited for us to discuss this.
Absolutely. So let's talk about what we're seeing right now.
Yeah.
I can personally say, as a physical therapist, that even I'm affected because
Yes.
I don't even have an OBGYN right now. They
Oh,
closed
wow.
that whole clinic down in my area.
Oh, wow.
So none of us have that access right now, which is crazy.
Yeah. Yeah. And OBGYN is like, that's a
Mhm.
big one because as a female, I have difficulty getting in to see mine.
Mhm.
Getting an appointment is
Mhm.
part of my issue. In my scenario, my I have one,
Mhm.
but accessibility to her is huge. I had a
Yeah.
different one a few years ago. He retired, and
Oh
so then
wow.
I went back to my original OBGYN, and getting into her is like pulling teeth. It's
I
one of the
believe it.
most difficult things to do. So as of right now, I haven't even been able to schedule mine for the year, and I'm past due. Um,
Yeah.
needing to go see her.
So
So
can you imagine clients not being able to see a specialist? We're
absolutely,
talking about OBGYN, but imagine a stroke patient that can't go see a specialist, a neurologist,
yeah,
or they're in a rural area and they don't have access to that. Like, that's a big
right.
no-no. That's a problem.
Yeah. And the issue with this is um the cuts that have been happening,
Mm-hmm.
so the accessibility goes way beyond things monetarily.
Mm-hmm.
It's being able to drive to see a physician or skilled clinician
Mm-hmm.
and not have to drive an hour and a half to get there,
Right.
or 2 hours to get there in some instances. And being in Georgia, some clients are, things are so spaced out here. So
Mm-hmm.
some clients are way, way out from their physicians.
Mm-hmm.
And to know that clinics being closed because of funding, that's another serious issue.
Absolutely. I'm also seeing, especially in our world, a lot of patients will say, "Hey, can I just do one time a week or once every other week?"
Yeah,
We're reducing therapy frequency. This is
absolutely.
crazy.
It is
This is
crazy. And it's so funny you said that. And this is a discussion I had with my office manager, because I've noticed the trend significantly in 2026,
mm-hmm.
whereas 2025 and earlier, and I've been open almost 9.5 years.
Mm-hmm.
This was never an issue. I didn't have room to get people on the schedule.
Mm-hmm.
Whereas now everybody comes in and they're like trying to break down their visit
Mm-hmm.
frequency. And
Yeah.
we're not talking, weeks in, we're talking
Mhm.
days in,
That's correct.
having the plan of care established.
Mm-hmm.
And so it's been a real struggle and a juggle as
Yes.
a clinician and as a clinic owner. And I'm sure, we're not the only two that's seeing it
Oh no, I think this is across the country in
across
all
the country.
fields, not just therapy. I believe in every field, every health field.
Yeah.
Think about the home health shortage.
Oh, yeah.
Now, back in the day when I worked in home care,
Mhm.
we saw patients like 3 to 4 times a week.
Yep,
Now we're seeing them, we might see them 3 to 4 times a week for like 2 weeks and tops, and that's it.
and
Then
that's it.
they're done. Insurance is cutting them off. You're done. You have to figure out what's next.
Exactly.
And they're putting a
Yeah.
hard stop on that.
Oh,
OTP
yeah,
is in home health, nursing is in for a certain time, and that's it. A
and
flat
that's
rate,
it.
you're done.
Yeah, and
It wasn't like
we're
that.
talking people. No, it wasn't, and it's so unfortunate.
Hmm.
And honestly, our government needs to do better. I'm gonna be quite honest, because
Hmm.
these are services that are due these people, and they
We're
need it.
paying into it.
Now, yeah, you're paying for your insurance, and your insurance is trying to find a way to
Cut corners.
pretty much cut the
I'm just gonna be
services
honest.
as much as they can.
Hmm.
Uh, because honestly, the bottom line is, let's face it, insurance companies are out to make money. Um,
Yes.
and the unfortunate side is that those of us that pay for these insurance plans are looked at pretty much as just a dollar sign for them.
Pretty much. Hmm.
Um, and so it's affecting the bottom line of service and care medically. And I am honestly scared in regard to the direction that in which we're heading, if it keeps moving in the direction that we're seeing. Um,
Absolutely.
yeah, because a lot of my clients are like, why is my therapy ending? Well, your insurance only allotted 6 visits.
Hmm. Correct.
This is the relevance of the conversation we had earlier about a few podcasts ago, where patients really are going to have to start monetarily investing in themselves.
Absolutely.
Cash pay service is really where it's going to end up being
Hmm.
the best choice for
Yes.
people. Now, in the medical regard, and you can't necessarily pay cash for a hospital visit, but
Mm-hmm.
definitely for the therapy side of things, that's a consideration they need to have.
Mm-hmm. Nope, I totally agree. And it's just mind-boggling, I have to say, that they the government is willing to just gut things
Yeah,
related to healthcare. Like,
right.
you want us to be healthy, and we produce money
Yeah,
as U.S. citizens.
yeah.
They take taxes from us, from our paychecks. So
They're the
I should be
the
able to have some good health care
I
in
think the
return.
motto that I've heard recently was "Make America Healthy Again."
Yep.
Well, it's hard to do that with
Yes.
the way things have been significantly cut, and
Mm-hmm.
the shortages that are out there. Now, I'm all for us being healthy,
Mm-hmm.
absolutely. Um, but you you can't get services, especially for people that really absolutely need it. A stroke patient needs those
Yes.
services. Someone
Yes.
with Parkinson's needs those services. Someone with
Yes.
MS needs those services. Someone with Guillain-Barré and a lot of these other neurological issues. Someone that's fallen and broken their hip
Mm-hmm.
needs that service,
Yes.
and you to pretty much essentially strip it away from them.
Mm-hmm.
It's such a significant limitation that they are given at this point in time with regard to the amount of service that they can receive. It's hard to have. It's hard to be healthy, honestly.
It is. Absolutely.
I know the MAHA, or Make America Healthy Again, has been more targeted towards the nutritional side of things, but
Mm-hmm.
you've got to think about it from more than just that side.
Right.
Um,
Mental and physical.
mental and yeah, you know,
Yeah.
I've always been an advocate for health because I've always believed that we literally eat ourselves into sickness in this
Mm-hmm.
country.
Mm-hmm.
So definitely agree that the nutritional side is important. Um, but
Absolutely.
there's so many other sides that we have to think about, you know,
Absolutely.
accessing our specialists, our doctors.
Mm-hmm.
There's such a difficulty with that.
Yes. I was researching last week, how CMS actually announced a temporary freeze on some new Medicare enrollments for home healthcare and hospice providers
Right.
while doing fraud investigations. I agree, fraud prevention is necessary, right?
Absolutely.
But we're we're concerned as providers about how these changes could unintentionally affect legitimate care
Right.
overall.
Exactly.
It's a huge problem. Like, I'm really concerned about our seniors, and
Very much
I'm
so.
going to be old at some point,
Yeah.
and I'm already thinking about how do I make sure I have money in the bank so that I can pay for healthcare, because this may not
Exactly.
be an option for me down the
Right.
road, 20 years, 25, 30 years from now.
That's right.
It may not be an option.
Yeah, because continuity of care is so important, and
Mhm.
when we think about our patients that we see, the neuro side, when there's a loss of the consistency in therapy, or the
Yes.
the ability to get their exercise and their mobility training, or the cognitive support, or the caregiver education, you know
Mhm.
that can help them with being safe and independent, and they're having
Right.
that overall quality of life. If they start to lose that, then they have lost that quality of life and care that we talked about in our most recent
Yes.
podcast with Dr. Johnson, that matters the most, as,
Mhm.
as far as those types of patients, our stroke survivors, our elderly adults, You
Mm-hmm.
know, our our pediatric patients with mobility
Oh,
impairments, even, you know, we have to think about even the caregivers who
yes.
are, you know, we've talked about it before. They're carrying such a burden, but
Mm-hmm.
to know that you're caring for somebody and that person can't get their services makes that burden even greater.
Mm-hmm. Nope, I totally agree. And that let's also not forget about preventative care
Yep.
versus crisis care. I know you
Correct.
mentioned it a little bit earlier.
Yeah.
But we need to discuss that as well because the research is
Absolutely.
telling us, it's actually showing us when healthcare access is harder, people often
Mhm.
delay care until conditions are emergencies. And that's why the emergency room is full.
It's packed.
The 8 to 12-hour or 24-hour wait sometimes in the
Yeah.
emergency room.
Exactly.
I've been there with
Yeah.
family members, and we're just sitting down there waiting.
That's right.
And that, creates a healthcare system that becomes reactive, which unfortunately, that's where we are now.
Right.
We're very reactive. We're not proactive.
We're not proactive at all. Yeah. And
So
the
that makes go ahead.
emergency room is is such a good example of, you know, the struggles of healthcare. If you
Oh
really
yeah.
want to see it in real time, visit an ER.
Uh-huh. That's right. 'Cause they will get you in and out of there, and you still don't have any answers to what's going on. And they'll go quickly send you
Exactly.
to your doctor, but then if your doctor isn't available, then what?
You're stuck like Chuck, like the kids would say.
It's like that. But that's why I'm super passionate about the brain health awareness, the stress management, the sleep optimization, and the nervous system wellness, because that's where it starts.
That's
If I
right.
can just help a lot of people become aware of that,
Huge.
I think things would drastically change with
Absolutely.
with healthcare, with the ability of
Absolutely.
people understanding what's happening inside and being having the mechanisms to cope
Yes.
a more holistic way.
Exactly. Exactly. You know, and waiting until burnout, you know, stroke, cognitive decline, chronic stress, disease
Mhm.
progression, it reaches a crisis level that
Yes.
affects, you know, not only a person's health, but their families, their communities, and
Mhm.
absolutely the bottom dollar, the economy. And prevention
Absolutely.
is, of course, not just physical. We're also seeing, you know, the emotional exhaustion, the
Mhm.
chronic stress. So we talked about the caregiver fatigue, the mental health strain, and,
Mhm.
and that's increasing across all communities.
Oh, absolutely.
Nobody is untouched
Nobody's untouched. I
uh,
see it every day.
every day. And
Constantly.
unfortunately, when healthcare becomes harder to access, you know, stress levels shoot
Mhm.
up even more.
That's correct. I'm starting to see a lot of young people with strokes,
I was just
20s,
thinking the same
30s.
thing.
I'm like, what is going on? But this is what's happening.
It's what's happening. Yep. Major topic in the neuro wellness world is, as a matter of fact, there was an article I saw recently that specifically highlighted that information.
Mhm.
People under 45, under 40 having strokes. That was unheard of when I, you know,
Heard
was
of.
younger. You know.
Mhm. Oh, that's real. Don't forget about the healthcare workers. We
Oh,
burn it out here.
the
I think I
struggle is
read
real.
yeah, the struggle is real. I think I read recently that there was like top 5 professions, and I think physical therapy was one of those professions that had the
Yep,
highest clinician burnout.
yep, yep. I
We're
read
struggling
that
out
too.
here.
Yeah, yeah. I read that too
It's
because it in our profession, and I think we talked about this once before. It's because we are facilitating care and dealing with somebody more from a pain perspective a lot of times.
Mhm.
And
Mhm.
then we see in the neuro side, we see a lot of debility,
Yes,
it puts that extra weight on you
it
to
does.
try to get your patient better. But in the midst of all of that, there's so many other factors that we got to think about. We got to think about, paperwork. You got to
Mm-hmm.
think about productivity. You got to think about, in our regard, we used to have to think about, well, I still do. You've been fortunate to not have to have this burden of staffing shortages anymore. But the exhaustion of it all is
Mm-hmm.
real. It is
Yes,
real.
it is. Yes, it is. It needs to be talked about a lot more.
A lot more.
Got to band together, honestly.
Absolutely.
Make it
Yeah.
really work for us because it will really be a huge shortage when healthcare workers aren't able to work,
Yeah.
or don't want to work, or don't have the desire to do it because they're just
Right.
exhausted, overly exhausted.
Yeah, exactly. And
It's
in
crazy how
regard
everything
to
works
what
together.
yeah, regard to what you said, I saw an article that talked about the number of occupational therapy students graduating has slowly declined over the past 5 years. And I
Mm-hmm.
think a major part of that is because there has been the issue of burnout and with OTs and
Yeah.
PTs. And
Yes.
so less people are wanting to get into the profession because of that.
Mm-hmm.
And then when you think about cuts to our reimbursement,
My gosh.
which
Hit
makes
the
it
nail on the
harder
head.
to pay a therapist that's come out of school what they really want to get paid,
Right.
um, harder to give raises, harder to not have a therapist seeing 4 to 6 patients an hour to
Mm-hmm.
maximize on the income so that you can pay them what they rightfully
Correct.
deserve. And then the unfortunate side is tuition is not going down.
Right.
So graduate with these overwhelming debts
Mm-hmm.
from their education that they have to pay. And
That is
so,
correct.
I understand them wanting the salary, and trust me, I want to be able to pay you, but
Oh yeah.
when you look at reimbursement rates, there's no wiggle room.
None. There's no wiggle room at all.
None.
None whatsoever. So it's a struggle out here. I
It's
have to say.
it's yeah, yeah.
I love what I
Mental,
do. I
yeah.
truly do, but
Hmm.
it's not easy. It's
That's
not
right.
easy navigating what's happening right now, navigating healthcare shortages. It's just not. It's really hard, and
It's
we're
very difficult. And
absolutely.
and somebody I saw was, questioning whether that was a big issue or a major issue with the transition of therapists actually leaving the profession.
Mm-hmm.
From what I've seen, the majority of it is mental burnout.
Yes.
People have come to the realization that my mental health is more important than
Mm-hmm.
anything else. So I'm seeking a non clinical role. And that's
Yes.
become a big thing for our profession in particular. I know in the physical therapy profession,
Mm-hmm.
people are seeking ways to make money and survive and not have that mental stress and strain that's on them.
Correct. That's real. That's a
Yeah,
big thing with non-clinical roles,
yeah, yeah.
and they're really highly competitive. So there are
Very,
a lot of
yeah,
people that are applying for those right now.
yeah. I had a conversation with a colleague recently. He and I graduated from PT school together, and he just recently transitioned to a non-clinical role. And he said it was the best move that he had ever made, getting
There you
out
go.
of clinic, clinical, clinically treating, because
Mm,
for him, he was experiencing burnout, had experienced it, and he was at the point where he said, "I have to do something different."
absolutely.
And so I told him I always thought he was a clinic owner, but he said he never did. So
Hmm.
he and I, we ended up discussing about another former classmate of ours from the same
Mhm.
program, who was a clinic owner, and he was saying that he was experiencing burnout. And I know for me professionally, I'm at that point myself where I
Mhm.
feel like some days the struggle is real, big
Yeah.
time. Yeah, and I don't think people really understand it, because I think that from what I've read, a lot of therapists within that 7 to 10 year mark start to
Mhm.
feel.
I
Uh,
say before that,
yeah,
I'm seeing clinicians 2 to 3 years out, like ready to be done.
yeah, yeah. The younger ones, I'm seeing that earlier
Mhm.
transition. Those that came out like around when I graduated in 99, and those that were between probably 99 and 2005, they kind of lasted a little bit longer into the 7 to 10 year mark.
Mhm.
Um, but yeah, you're right. There are those who are like 2 to 3 years in, and they're like, "Can I do something else? I'm looking for something
Right.
else. I need to. I can't do it anymore. This is just too overwhelming." And,
Mhm.
and it's become more than just thinking about the conversation is more than just thinking about policy, but
Mhm.
really, honestly, there needs to be some policy. We need these
Absolutely.
associations fighting for us and
Mhm.
advocating for us, because in the past 5 years there has been a decline in
Mhm.
reimbursement, and
Mhm.
so there's only so much you can take before you have to consider, do I need to close my doors?
Yeah. I feel
Uh,
like we are behind
yeah,
in regards to reimbursement, even pay.
yeah,
I know people
absolutely.
that have been out 20 years and they still being paid about the same, or they're not getting bonuses or anything. But it's again because reimbursement is so small, so
Yeah,
little.
yeah,
But the problem is, yeah, policy is needed, and I think it's talked about. But I've been out 20 years, and I still haven't seen an increase in reimbursement. It's gone
yeah,
down as
yeah,
long as I've been practicing. So I don't
exactly.
really know what's going on with that, honestly. What's happening?
I think initially when I opened the clinic, a there was a yearly increase. Wasn't anything significant, but it was a
Mhm.
yearly increase of a few cents. So every year there was a little bit more being added in. And
Yeah.
I opened my clinic in 2016. So 2016 up until 2021 ish, and then
Mhm.
from 2021, then you start to see, okay, we're not gonna take away from the main pot, but we're
Right.
gonna start taking away from if you hire a PTA. Okay,
Mhm.
we're gonna allow you to do a little telehealth, but you can't do it for very long, so we're gonna take that back away.
Mhm.
We'll add in some remote therapeutic marketing, but then we're gonna have to decrease the main pot a little bit on that. So there's this constant finagling of,
Yes,
okay, where are they gonna take it away from this year? You
that's
know,
correct. Mhm.
so it's insane. It's frustrating. It makes you feel like you're devalued, um,
Absolutely.
especially in the therapy world. I don't
Mhm.
know how things are medically, because I can't talk about it from that perspective, but I know in the physical therapy world, the battle for the little bit of sense that we get is unreal, and it's frustrating.
Mhm.
And I need the government, I need these insurance companies who feel like just having these CEOs with millions of dollars worth of salary and profit every year to get it together. I need them to get it together,
That's
because we are
real.
going we are going to lose out on really good clinicians,
Mm-hmm.
and the people are going to suffer.
Absolutely.
You think that we are not an asset until you don't have us.
That's it.
Imagine a world with no physical therapists.
Mm-hmm.
I wouldn't want to live in it.
Help me
Honestly,
recover. Yeah, no. That's
I
tough.
would. Yeah,
That's really tough.
yeah,
Wow. So this has been an amazing conversation, I have to say.
yeah, yeah.
And I hope our
And
listeners are encouraged and more informed about being more proactive and more compassionate about the challenges that we're facing in healthcare today.
I agree.
You know, healthcare accessibility affects all of us.
Every last one of
All of
us.
us. All of us.
Yep.
And the real question becomes, what kind of healthcare system do we want future generations to inherit?
Absolutely. And I want our listeners to advocate for your healthcare professionals. You made, and advocating for them may require you to call your insurance companies and express some concerns.
Yes.
It might require you to complain. Call your congressperson, call your senators, and start letting these people know that these are services that you deserve and you're not getting. And they need to do something about it.
Absolutely.
Advocate for your healthcare professional. If nothing else, if you don't get anything else out of this conversation today, understand that your healthcare, your quality of healthcare is at stake.
Yes.
And it's going to take us as a people to come together and start to advocate for what we deserve.
Absolutely. What a beautiful closing, Dr. Lewis.
Thank you.
Hope you all enjoyed this episode, and thank you for joining us tonight on Neuro Wellness Conversations.
Thank you all.
Until next time.
Until next time.
Thank you for listening to Neuro Wellness Conversations, where clinical insight meets lived experience. If today's conversation resonated with you, share this episode with someone who could benefit. Be sure to subscribe so you don't miss future conversations on neurologic wellness and nervous system health. Until next time, keep supporting the nervous system that supports you.
Let's have a conversation about cognitive decline.